Hi everyone, here are 3 pieces of equipment that you should be adding to your management program if you have DeQuervain's. Is the wrist brace, okay, or specifically called a thumb spica brace. And this brace is different in the sense that it includes your thumb. So a lot of times when I hear about a patient or a client getting their brace as recommended by their medical provider, I see that they've gotten the wrong brace, right? They've gotten actually the brace that more often is common for carpal tunnel syndrome. And it's different in the sense that the one for carpal tunnel syndrome doesn't include the thumb. And you definitely want to make sure that the brace you get includes the thumb, because it's thumb movement that we want to go ahead and limit and rest, because those 2 tendons that are involved in DeQuervain's, they get aggravated with excess thumb movement. They also get aggravated with excess wrist movement, too much wrist movement, okay? So you want to make sure that the brace that you get also restricts wrist movement, okay? And I know it's horrible to hear that word restrict, right? But that's exactly what is needed for an injured, painful, overused hand, wrist, thumb, body part, right? You need to rest it. So this sort of brace is wonderful, and I'm always constantly looking for one that isn't too bulky, that just doesn't feel like it's this big humongous thing, okay? Because I know it's already uncomfortable enough to wear this brace. So again, I'm always trying to find something that is more comfortable, what we call low profile, I mean it's not bulky, but also that it's not too long, okay? So we do want it to cross the wrist, meaning it needs to be able to cover the wrist. And it's long enough, if you see that, like I said, it restricts wrist movement, okay? Typical ones that I've recommended in the past have been longer, but again, it doesn't necessarily need to be that long, as the length that you have is restricting wrist movement, okay? Now, when you wear this, you want to make sure that you're not wearing it so tight that the Velcros aren't so tight that it's cutting off circulation through your thumb, your palm, and your wrist. I always say to wear it as loose as you can get away with, meaning it still feels like it is nice and snug on your hand, but it's, again, not cutting off circulation. Also, you want to feel like it's not going to slip off, okay, or it's not going to rotate on your hand. So again, you want to make sure it has these components. It includes the thumb, it crosses the wrist, it covers your wrist. Another thing that I try to look for when I am choosing a brace to recommend is that it doesn't have the metal pieces, because there's metal pieces in the brace that helps you to keep the thumb and the wrist still. So those metal pieces are necessary, but if those metal pieces are pushing on that very tender spot over those tender tendons, then you're not going to want to wear it, right? So this brand that I found, it's called Cure Care. I found it on Amazon. It actually puts the metal pieces, it puts it on either side of those tender, sensitive tendons, okay? So that's wonderful. Again, this is called Cure Care, and I'll go ahead and put a link for it down below so it's easy for you to find. So the other piece of equipment that I highly recommend is this here that I have taped to me. It's called kinesio tape. Now, kinesio tape is not like other tape. It actually has a very significant, very important ability to actually cause change in your body, okay? Because of its properties of elasticity, where you can stretch it out and it also will recoil, it can actually influence how your body is working, okay? It can do things as assist muscles and tendons in movement, or it can help restrict it. It can help move fluids. It can do all sorts of things that us therapists will take advantage of in trying to meet our goals for our patients. So like I said, it can help assist tendons and muscles, or it can help restrict tendons and muscles. So kinesio tape, like a lot of overuse injuries or a lot of just injuries period, DeQuervain's can benefit from the use of this. Okay, so with this is something that I would recommend in addition to. So it's not something that by itself will make your DeQuervain's go away. It's something that it is a part of your management program. Okay, so I would have you wear it underneath your brace. I would have you wear it when you can't wear your brace, those few times you can't wear your brace. I would have you probably continue wearing it after you've discharged yourself from the brace, just to give you a little bit of support as you transition away from your brace and towards doing more with your hands. Okay, just something to support you as you progress in using your hand more. Okay, so this finally the last thing that I recommend, it's something actually that is not as important to have absolutely on your management program, but something that I will recommend to a patient to help improve their comfort is this edema glove here, this low compression edema glove. And like this name sounds, it's to help with swelling. It's to help push the swelling away from your hand. But the reason why I will recommend it to a patient is that wearing it is comforting. It's like this nice little gentle hug that, kind of like when you're hurting, what your instinct is to grab where it hurts and give it a gentle squeeze, right? That's what this glove does. It helps to just give a gentle squeeze. And like I said, it has the bonus of helping to move swelling and excess fluids away from the hand and towards your body, where your body can get rid of it. And this is an important thing. This is a necessary thing, because too much swelling in the injured area that stays there for an extended period can cause problems. Okay, so this is an isotoner edema glove that you can again find it on Amazon, but I'll go ahead and put a link to it down below. Okay, so those are the 3 pieces of equipment that I highly recommend, that I always recommend to patients and clients with DeQuervain's that I work with. Okay, so like I said, those first 2 I very, very, very much will encourage. Those are the definite game changers in your management program. But like I said, those 2 alone won't be all you need to help solve your pain, but they are very, very important things that you need to do. The last one with the edema glove, like I said, I recommend it if you feel like you just need a little bit of extra comfort. Okay, now if you want even more details on these 3 pieces of equipment, more information on when to wear it, how to apply it, like for the kinesio tape, then go ahead and sign up for my free guide that goes over those in even more detail. Okay, so go ahead and message me in order to get them. If you are watching this on my social media, you can go ahead and message equipment and I can go ahead and send it to you. Okay, otherwise, don't forget to follow me to get more tips, to more education on how to decrease, manage, and prevent your DeQuervain's pain. Okay, take care.